So if a man is having urinary issues due to BPH, what are treatments that are available?
Boy, it's a huge industry. There's herbal products like Saw Palmetto, Krilla, other things that anti-inflammatories like curcumin. These things may improve urinary symptoms. Then you're on to the pharmaceutical agents like Flomax, Myrbetriq. There's a myriad of different products, and often are pretty helpful in making sure that men aren't waking up so frequently at night or rushing to the bathroom with a strong sense of urgency or urinating too frequently. These are the main complaints that we see. And then, of course, if those reversible treatments aren't working, usually we start with pills or something that you can stop and start. You're not going to dig yourself a hole you can't get out of. But men that don't respond to those then can go on to other treatments like Resume or Urolift, embolization, some sort of laser TERP. These things are done by urologists and are effective in improving symptoms, but they do come sometimes with some risks and side effects that in rare occasions don't go away. So it's a huge field, honestly.
So is the average urologist trained to handle all these types of BPH treatments?
Absolutely. This is the bread and butter of the urology world, is to take care of men with large prostates, prostate cancer, and basically anything directly related to the genitourinary tract.
Are there certain types of BPH treatments that you have seen maybe have some lasting long-term side effects that you would prefer men not have?
Well, anytime you have a procedure where they go and cut part of your prostate out or something like that, there are small risks of incontinence. It's quite common for men to get something called retrograde ejaculation, where they have dry orgasms, and other things can happen. For the most part, the net benefits are positive. These treatments don't work in everybody. So you can't go into, say, a transurethral resection or a laser TERP, it's called, with 100% certainty it's going to help the urinary symptoms. But it often does. It's often effective, and it does have some risks.
You mentioned embolization for the prostate in regards to BPH. Can you explain how that works?
So when the prostate is super enlarged, sometimes it's pressing on the urethra and creating difficulty for urinary flow. And there are specialists, interventional radiologists, that can thread tiny little tubes, catheters, or straws through the bloodstream into the prostate and then inject substances that block off the blood flow. And when you deny the blood flow to the prostate, or any organ for that matter, that tissue dies. And when it dies, then the gland will shrink down in size. And embolization, it appears to be effective in some men. Like many of the treatments, it doesn't work in everybody, but sometimes these gentlemen are desperate. Their bladders aren't emptying properly, or they're just, totally in a bad way with urinating really frequently, and such measures are appropriate.
So Dr. Scholz, you mentioned Myrbetriq, Flomax. I know there's many others. Are there any benefits to one over another?
Well, they work by different mechanisms. So if one is not working, you might be able to switch over to another. And also, if one of these medicines is giving a partial effect, you can add a second or a third medicine. There's another category we call, the 5-alpha reductase inhibitors, Proscar and dutasteride, which shrink the prostate by blocking dihydrotestosterone. So you can even be on all three types, the alpha blockers like Flomax, Rapaflo, Uroxetrol, these medicines, Myrbetriq, which reduces the irritability of the bladder, and the 5-alpha reductase inhibitors to shrink the overall size. So some men that don't respond to just one might do better with 2 or 3. We always have to mention with the dutasteride and the Proscar that there is a risk of reduced libido from these medicines. And so people need to be warned if they start to run into those side effects, they have to stop the medicine. But they're good. I mean, it's usually we'll start off with an alpha blocker, and if you don't get a satisfactory result, add some Myrbetriq. And the goal, of course, is for men to go to the bathroom less frequently, be able to sleep through the night, and be able to empty their bladders completely. These men are dealing with this, on a daily basis, and it can really improve their quality of life.
You also mentioned supplements very early on in the list of treatments. So what type of results have you seen with those supplements? Are they as effective as the pills?
In my experience, they aren't. It'd probably be like taking a third of a Flomax if you think of something like Saw Palmetto. So if people have very mild symptoms, they can buy these things at the pharmacy without a prescription. They can try it. The results should occur within a few days if it's effective. And if that works, that's great. But oftentimes the people I'm seeing have already done that, and it hasn't helped them.
Are there any side effects to those supplements?
Not that I've seen. No, they're very well tolerated.
So really, I think the major takeaways is that less is more in the beginning, that you should start maybe with supplements and then go to pills and then look at the procedures and not go straight to the procedures considering the side effects. Mm-hmm. And then the second, I would imagine, is that it really is important who the doctor is if you're going to get to that procedure level and research, are they experienced and do they know all the different types of treatments and do they have your quality of life in mind?
I agree.
Thanks for watching. If you would like more information about prostate cancer or any of the topics we talked about today, you can go ahead and visit our website, PCRI.org. Also subscribe to our YouTube channel. This will keep you updated on all of our new videos, and give us a thumbs up if you like today's video. We hope you have a great week.